Hey guys, this is KIN 236 Module 3 Application and Review. We're going to be looking at the muscles of the cervical spine in a little bit more detail and following up and applying what we learned with the trunk musculature. So just real quick, if you want to look at this question, this will be a question that would be like on the exam. What muscles are shortened when doing crunches with the knees flexed and the hips flexed and allowing for better isolation of the abdominals? And the answer here is psoas major. And the reason why the psoas major and not the rectus femoris or iliacus is that all three of these muscles are hip flexors. So you might want to say all of the above or none of the above, but this is looking at the passive and active insufficiency. Although all three of these are hip flexors, the iliacus stays at the pelvis. It doesn't go into the trunk at all, so it's not a prime mover there, so this is not part of the equation. And then rec fem, although hip flexor, again, more lower extremity, it's a biarticulate muscle. It does have an effect on the knee, but again, not on the spine, so again, out. So in the end, the psoas major, when you flex it, you're putting the hip flexor in a shortened position, so all three of these are shortened. So then you are allowing for better isolation of the abdominals because this also goes up into the spine. So again, remember this is chapter 11 out of the textbook, and this is the second lecture, the first one obviously being done in class. So the main point of this lecture is looking at the ability to do these movement analyses. So looking at the specific trunk and spine musculature, the actions. Again, it's a continuation of, are we looking at concentric, eccentric, what joint actions are happening, and what muscles are involved in that movement. So the muscle actions are our key focus here. These are the movements we're looking at. We're looking at the cervical movements, cervical flexion, cervical extension, capital flexion. So remember, the capital is looking at the head moving on top of the spine, whereas this is looking at the cervical spine moving on top of the thoracic spine. So cervical versus capital. You have lateral flexion of the cervical spine. You have a little bit of lateral movement in the capitis, but not so much. And then there's no movement in the transverse plane of the capital movement for rotation. The only rotation is happening in the cervical spine. Then you have the thoracic lumbar and some pelvic aspect, but mostly thoracic lumbar in terms of spinal flexion, extension, lateral flexion, and trunk rotation. So these should be review. So the textbook is really great when we look at the chapter reviews, not necessarily the lab exercise, but the review exercises. So if you look back at those books, you should look back at those movements, and you should be able to list out those muscles. If you feel pretty confident doing that, you'll be okay on the exam. We're going to go through some of the examples today. And we're going to so the muscles that we haven't gone over yet have been the cervical musculature. I introduced a couple of the shoulder oddballs, the levator scap and the trapezius involved in that, but that's what I want to spend some time now going through the specific musculature of the cervical spine, particularly with rotation, lateral flexion, and trunk movement. So the first muscle is the sternocleidomastoid, also referred to as the SCM, so SCM. And this is an image right from your book, and it does have the ability, if you have one attachment here and one attachment there, it's going to go towards each other. And so in this case, you can see what it's showing you here is that if this muscle pulls like a rubber band, it's going to pull the capital into a little bit of extension, but mostly what it's going to do, it's going to bring the head forward, making a cervical flexion. So it involves in cervical flexion. Some argue that depending upon where the head's at, it can go into cervical extension, but it's not so much cervical extension, it is capital extension. It's a very specific detail that I do not plan on testing you on, but just I wanted to share it with you. But just think of, in terms of sagittal plane motion, the SCM is a cervical flexor. In the transverse plane, we don't have an image you can see here a little bit. I'm sorry, in the frontal plane, when you look here, you will see this. Let's say this is the axis of rotation right here. If this muscle contracts, it's going to do lateral flexion to the same side. So it does ipsilateral flexion. And then when we look at the transverse plane, because of the angle here, if you see the origin down here at the front of your collarbone, and it has a line of pull, an attachment insertion back here at the mastoid process, and this is your ear, so behind the ear, if this tries to shorten, it's going to pull this attachment forward in this direction. So with this movement here, it's going to create rotation on this right side muscle. It's going to create opposite side rotation to the left. So you're going to have left cervical rotation with the right sternocleidomastoid, and the left sternocleidomastoid is going to do right cervical rotation. So you're going to have contralateral. So here again from your book, cervical flexion, same side lateral flexion, and contralateral cervical rotation. The other set of cervical musculature here is the splenius musculature, and there's a cervicus and a capitis. So same muscle, you can see the attachment here. Let me change my pencil here. So you can see the attachments are here, and it goes up on the cervicus, goes up to the cervical spine on the transverse process. And then the capitis, because it's the head, it has the same origination at the spinous process, becomes all the way up and attaches up here at the capital ridge. Muscle function is exactly the same. Two exact muscles just pulling on different aspects, but the outcomes are identical. So it's equivalent to the erector spinae, where it has it makes like a V shape. So these muscles here, the left side capitis and cervicus, the splenius musculature, is going to do the same side rotation, so ipsilateral rotation. So when this muscle pulls, it's going to pull these guys back, and it's going to pull the head in that direction to the left. Same thing here. These guys are going to pull. It's going to try to pull the cervical spine. Let me just. So here's this attachment here. There's that attachment there. When this muscle shortens, it's going to try to pull this that way. It's going to grab that, and the head's going to turn to the left. So splenius musculature for the transverse plane. Same side for frontal plane motion for lateral flexion. And for sagittal plane motion, these guys are going to be extensors of the cervical spine and capitis, not flexors. And you can see here cervical extension, ipsilateral, so same side rotation, and then same side lateral flexion. So a review now, because we're getting into the trapezius muscle, and the trapezius muscle primarily is a shoulder muscle. When we get back into the shoulder unit, we're going to talk a lot about this. It's the second largest muscle of the body. I'm sorry, third largest muscle, second largest of the upper body. Very important muscle for function. And we're just introducing it here now. Its primary role is on the scapula. So here you can see the attachment sites. There's that attachment site, and then it originates all the way around here along the spine. And it has an upper division right here, has a middle division, and has a lower division. So for our conversation here with the shoulder, we're going to focus mostly on this upper division. So with the upper division, the way that the muscle originates, it starts here on the spine of the scapula, and it comes up, and it attaches right here on the capital ridge, on the occipital ridge. And if this muscle pulls, what it normally does, we know the trapezius has the shrugging motion, so it's going to want to pull the muscle fibers up this way, like your shoulder blades going up to your ear. But if the shoulder is stable, you keep your shoulder blades down, these fibers still shorten, so instead of the shoulder moving up this way, these fibers get pulled back in this direction. And what it has an effect, since it's so towards midline here, is that it actually does opposite side rotation, does contralateral rotation. So it's going to take this attachment and try to move it this direction, and so it's going to turn the head to the right. So the left side upper trap does opposite side, right side cervical rotation. Again, don't worry about remembering the trap for the elevation and the shoulder movements. We're going to get a lot into that in the shoulder unit. So you can kind of see here this image. This is the normal movement that we think of with the trapezius. We think of this shrugging motion, and it does cervical extension. But the new movement we want to think about here is this cervical rotation. So if it's going to pull this direction that way, it's going to pull the spine that way, and so the head's going to look to the left. So the back of the head's rotating to the right, the front of the head's rotating left. We call that left cervical rotation. The other scapular muscle, shoulder musculature, is the levator scapula. You guys aren't able to see the image here. So the levator scapula, This is a muscle that originates here on the superior angle of the scapula, and it comes up and attaches to the spinous processes of the cervical spine and these upper five, C1 through C4. So when this muscle shortens, what it normally does, it's called the levator scapula because it elevates the scapula. So you're going to see the scapular elevation in this direction. But that's if the head is stable and the scapula is free to move. You're going to do that shrugging motion. So it's going to work in conjunction with the trapezius. So both the trap and the levator do scapular shrugging, elevation. But they also, because of their attachment on the spine and the skull, they can do cervical rotation. Excuse me. So unlike the trap, where the trap was attaching out here and pulling the head back and making the head go this direction, the levator has a similar attachment to the splenius musculature. So the splenius was originating here and kind of coming out to the side and hitting these guys here for splenius cervicus. And so those were doing same side rotation. Levator also does same side rotation. It has an attachment here, has an attachment here. When this muscle shortens and the scapula is held stable and the head's free to move, the head's going to try to go in this direction. The head's going to move in the left direction because it's going to take these spinous processes, these transverse processes, and it's going to pull these back towards you in the screen. So it's going to pull this back and it's going to do same side rotation. So upper trap does contralateral rotation and levator scapula does ipsilateral, same side rotation. So again, let me just review that. You have these muscle attachment here, you have these muscles attachment here. You can see 1, 2, 3, and 4. And when this muscle shortens, it's going to take those and it's going to try to move them in this direction. So it's not moving the head, it's moving the vertebra. And if the vertebra, the back of the vertebra moves this direction, that's going to turn the head this direction. I'm sorry, I totally said the opposite. It's going to pull these guys back and the head's going to move in the same direction. It's going to, where the cervical spine goes, the head goes, because it's not pulling on the capital, it's pulling on the cervical spine. So the cervical spine is being pulled back, it's going to be pulling back to the left, and so where the spine goes, the head follows. So left cervical rotation. Let me just go back up to the previous slide to review the trap again, just to kind of confirm. So the trap, because of the fiber attachment, it's pulling on the back of the head, not on the cervical spine here. And if it does pull a little bit on the cervical spine, but it even reinforces that. Instead of pulling on the transverse processes here, it's pulling on the spinous processes here. And so it pulls these guys this direction, which makes the head turn to the right. It pulls on the back of the head this direction, which again makes the head turn to the right. So the trapezius, the left side trap involved in right side cervical rotation. The levator scap as an elevator, same thing, but it when it contracts, it's going to grab the the transverse processes, pull these back, and it's going to create same side cervical rotation. So upper trap, right side, the left muscle does opposite rotation. The levator, same muscle, does the same side rotation. And you can kind of see the levator scap here. It is a better picture. It kind of goes out onto these transverse processes. When these contract, it's going to pull that head back and it's going to do ipsilateral cervical rotation. And now you can see all three of the muscles. You can see the upper trap. You can see the splenius, capitis, and cervicus. And you can see the levator scapula, and all three of these muscles are going to work. So the splenius and the levator, same side rotation. So these right side musculature is going to turn these guys to the right, and this left side upper trap is going to also, so all three are working together to turn the head to the right. Left cervical rotation would be right upper trap, left splenius, and left levator. Let's do some practice. So here's an example, passing an exam to a person behind you. So you're sitting in your chair and you're turning to your right. So the questions are, what is the action? What are the agonists? And what are the antagonists? So without looking at your notes, try to determine what the action is and try to guess some of the agonists and some of the antagonists. When you guys are solving these problems in class, or on the exam, the agonist and the antagonist should be opposite movements. So if you've determined what the action is, hopefully it's right rotation, you're going to be looking for the right rotators, or the antagonists are going to be the left rotators. So in this case, the action is rotation. The rotation is to the right, and the agonists are going to be, for the trunk, the same side, internal oblique, opposite side, external oblique. So left external oblique. It's going to be the right erector spinae, so same side erector spinae, opposite side transverse spinalis group. And then you're going to get the head motion as well now. You're going to get the same side splenius musculature. You're going to get the opposite side SCM. You're going to get the opposite side trapezius, and you're going to get the same side levator scap. And the antagonists are going to be just the opposite of these muscles here. How about this one? So reaching down to pick up a briefcase on your left. So if you're here, he's going to reach down and pick that up. Take some time, figure out what the action is, what are the agonists, and what are the antagonists. Go ahead and pause the video. So hopefully you got, for the action, you got left lateral flexion. But now, because he's in a gravity situation, he's going with gravity, the agonists are not going to be the same side movers. They're going to be the opposite side. So the action was lateral flexion to the left, so left lateral flexion, but it's going to be all the right side musculature, right erector spinae, right transverse, all these muscles. Everything on that right side, because he's moving down eccentrically to pick it up. So these guys are working, these guys are the ones that are contracting this left side. These guys are off. These guys are on. I should make that a negative sign. Negative, off. These are on. And then as he comes up, as he picks that up and comes up, same muscles are the agonists. So these are the muscles that are working the entire time. Now, if he was laying down on his back and he was supine and he bent down to like maybe scratch his knee or scratch his leg, let's say this was, instead of this being a wall, let's say this was a floor, him bending down, the agonist then would be all the left side musculature, because these are the ones that are shortening and contracting in order to do the work. In this case, when he's standing, so here's the ground, he's standing upright, gravity's trying to pull down, these muscles don't have to do anything for him to go forward to the side. These are the ones that have to slow him down and pull him back up. So hopefully that's clear. It's very important to make sure you understand which position your client's in, whether they're on their back, standing, are they with the effect of gravity or not. So in this case, the right side musculature are the agonists, the left side are the antagonists. Okay, so go ahead and read this. Take a second and see if you can figure out the position. I purposely don't have an image here because sometimes you're going to get test questions that don't have an image, and so you're going to have to read the text, read the words, and then convert that into an image or into a movement. So go ahead and read carefully. Maybe demonstrate your hand, and go ahead and pause the video here for a moment. So what you should have seen from an image, if you look at this, taking your head and put it to the right, is this here, where you have your right hand up against your head, and you're trying to move your head in this direction. So you're doing an isometric contraction. You're trying to do right cervical lateral flexion. So that's the movement you're trying to do. These muscles are contracting here, so if this is the axis of rotation right there, everything on this side is going to be the agonist is going to be on. Whoops. Everything on this side is going to be off. It's going to be negative. So these are going to be the agonists on the right side. These are going to be the antagonists on the left. So lateral flexion to the right. It's an isometric contraction. Remember, for movement analysis, isometric is the same as concentric. You're trying to generate force, you're trying to overcome gravity, it's just not happening, but it's still an attempt. So it's not like an eccentric contraction, it's like a concentric. And so everything on the right side would be the right SCM, splenius, capitis, and cervicus, and the right erector spinae group. So when you're lying supine, go ahead and read this one again and see if you can visualize the activity, see if you can answer these 4 questions here. And go ahead and pause the video and give yourself some time there. So hopefully you saw this image here. So this is, we said lying supine. So face up, like laying down in bed, and you're trying to bring your right ear to your, your left ear to your left shoulder. So we're looking at this position here. And you should have gotten these sides as the agonist, this side as the antagonist. So all the musculature here on the left side, that's going to be trap, levator, SCM, all these guys are going to be on, and these guys are going to be off, right? Antagonists are going to be, these are going to be the shortening muscles, and then these guys are going to be stretched into lengthening of muscles. So I think it's what I asked here. So what type of contraction is concentric? Left lateral flexion. The muscles that are the agonists are the ones that are shortening. The muscles of the antagonist are the ones that are lengthening. Remember, it's the same as acting shortening versus lengthening, agonist versus antagonist with the type of contraction. Just like with the suitcase problem, what if you were standing up and you were doing the exact same motion? So if you were standing up, gravity is down. This is no longer a concentric contraction. This is an eccentric contraction. These guys are off. They're not working. They don't need to because gravity is assisting the head down this direction. These guys are on now. They're contracting. They're slowing the head down, and then the same muscles that are bringing up. So it would be the exact same joint analysis. What you see is always what you get, but because of the orientation of gravity, these now are the antagonists. These are the agonists. Even though these are quasi-shortening, these are lengthening actively and then contracting on the way up for repositioning. Another exercise. Go ahead and pause the video. Hopefully you visualize this. So instead of doing a full sit-up, it's a neck up. So you're bringing your head up and back down. And the question asked, is your cervical spine flexing or extending as you raise your head? And the answer is that it's cervical flexion, right? You're trying to bring the two joints closer together. They're extending to go back to neutral, but you're still neutral. Now, if let's say the end of the table was right here and her head was free and her head was able to come back, some books inappropriately wrote that as hyperextension, but that's just a continuation of cervical extension. But this is neutral at 0, and this is the start position. She's coming up into this position, cervical flexion. Gravity is trying to pull the head down. So that's a concentric contraction because you overcome gravity, and it's going to be the anterior neck musculature. It's going to be the agonist. So that's the SCM. So that means everything else we talked about, the trap, the levator, the splenius muscles, the erector spinous, all of those are the antagonists. So again, another application. So it's the exact same activity, but it's looking at the downward phase. So instead of this being the starting position and this being the end position, this is now up, down, and now you want to analyze from your head in the flex position, moving back down to the table. And so what muscles would be the agonists in this action? It would be the exact same muscles that you did on the way up, but now instead of being it would be an isometric at the top, and then on the way down, it would be these muscles hold, and then on the way down, it would be eccentric, and it's the exact same muscles. So the muscles that get you there, 90% of the time, are the same muscles that get you in the repositioning, just in a different phase of contraction. So let's start looking at some exercises now instead of looking at positions. So when you're lying on your back with your knees flexed and feet flat, you're going to put your right hand behind your head and you're going to lift your shoulder toward your mat. So you're basically doing a crunch with a little bit of trunk rotation. So that's what's happening here. You're doing a crunch, so you're doing trunk flexion with right rotation. So you're getting, your left, or you lift your right shoulder and scapula off the mat. I'm sorry, I said left. But you're bringing your right arm to your left knee. So I'm sorry, you had it reversed. So you bring your right arm to your left knee. So you're doing trunk flexion and left rotation. So I said left arm, but right arm. When you're contracting, you are doing concentric activity for the rotation, and then on the way back, you're doing eccentric. And then the muscles are contracting for the flexion because you're doing trunk flexion. You're doing the rectus abdominis, bilateral obliques, and then for the rotation component, because you're doing left rotation. I guess this is why the eccentric aspect is that you're going to be left trunk rotation. You're going to be doing the right external oblique, left internal oblique, and then the left external rector spinae, and then the eccentric on the way down. So as you come up, you're overcoming gravity both in trunk flexion and rotation, and then on the way down, you're doing eccentric. It's the same muscles. It does not change on the way up and then on the way down. Just making sure you get the phases right. But just make sure that you know that this is trunk flexion. You're doing rectus abdominis, bilateral obliques, and then to get that rotation component, you're going to have less drive to the left external and right internal, and you're going to create that rotation. So again, going to those review questions, but I pulled some of them out here for you, for us to talk about together. The push-up, hopefully it works. It's a video within a video. It's not an upper body analysis, but we could. But right now we're looking at the shoulder motion. Gravity is down. And so what we want to analyze is one of the forms for the push-up is making sure that you're straight all the way across. So making sure the heels, the butt, and the scapula and the head are all in a proper alignment. He's kind of cheating a little bit, but he's doing an incline here. But gravity wants to pull the hips down. That's not happening. So this is a trunk and spine exercise. He's holding his head in a certain position. He's holding his trunk in a certain position. So the question to you guys is, what muscles are involved and what joint actions to do that? So go ahead and pause the video and see if you can analyze the joint actions, the muscles, and we'll come right back. So lift and lower. So on the way down, there's no movement, right? The spine's not moving at all. So we want the spine to be neutral on both aspects, so it's isometric the entire time. Gravity is trying to pull him down into spinal extension. I'm sorry, into spinal extension. So you are going to be engaged in the anterior abdominal musculature for the to keep that spinal neutral. The other muscles are going to contract here for that, but this should really be the anterior abdominal musculature for that. So let me just cross this off. These guys here, no, no, no. So we're looking at the rectus abdominis, the obliques, transverse, and then in the head now, we are looking at cervical extension being held because the head wants to be pulled down. So then these cervical extensors are going to be working to keep that head in a neutral position. So we can go back up to that image to see. Remember, gravity is trying to pull his hips down. So he's these muscles are trying to lengthen. These muscles are going to be shortened. So in order to keep this neutral, these muscles here are contracting. And let's say this was a static position. What exercise would this look like? This would look like a plank. And you don't do a plank to train your back. You do a plank to train your abdominals. So it's the anterior musculature that are holding you in this position. So I apologize for this slide. These shouldn't be here. These erector spinae. This should be anterior trunk flexors and posterior cervical extensors. And you can kind of see it here in this picture here. Hopefully this works. Yep, perfect. And you can see the abdominal sheath, you can see the rectus abdominis, the obliques on that side, and they are contracting in order to keep that whole spine straight and rigid. So sit up, flex knees. So lift phase, lower phase, which is the lift, which is the lower, and what's the movement, what's the contraction type, and who are the agonists. Go and pause the video, see if you can fill that out. So on the way up on the lift phase, it's flexion, that's concentric, and it's going to be all the abdominal musculature. And then don't forget the head, right? The neck is coming up into flexion as well, it's trying to hold back. Gravity's trying to pull that head back into extension. So you need the SCM, the anterior musculature, to hold that. And again, it's the same muscles on the way down. It's rectus abdominis. It's just working now eccentrically. Now this is the equivalent of trunk flexion. If this was in a standing position, these would be flipped. It would be eccentric first, then concentric, even because you would start going forward, and it would be the extensors, not the flexors, that are working. You can see it's here. Anterior musculature. So the next exercise is prone extension. So this is let's say you're laying on your bed face down, and let's say someone's sitting on your legs, or your legs are anchored, and you are trying to lift your trunk up. So you're like a seal trying to look forward. The lift phase is going to be trunk extension, cervical extension. That's going to be concentric. That's going to be the trapezius. It's going to be the splenius capitis, the rectus spinae, quadratus lumborum. On the way down, you're going to be going from an extended position to a flexed position, but it'll be eccentric, but it's going to be the same muscles. Leg raises. So again, the previous trunk flexion exercises was the pelvis, legs being stable, and the so it was this moving towards the legs. In this case now, as you can see, the legs are moving towards the torso. So hopefully you're realizing that's the exact same musculature. In this case, it's going to be the trunk's not really doing much, but it's going to be hip flexion, so the psoas and the, but depending upon how much tilt he was getting, which let's see here. So the question's being asked in a way that is trying to minimize the amount of pelvic tilt, but you can see that his butt is coming off the ground a little bit. So if this truly was like if he was just doing hip flexors, but he's getting that pelvic tilt there, and you can actually, here, we'll just watch the video again. My mouse is not working. You can see those abdominals contracting. Yeah. So the trunk is not moving, it's isometric, but it is the, so there's not a lot of pelvic rotation going, so you're not going to see a lot of movement, but the same musculature that you're seeing, you're going to see the, remember, concentric and isometric, same muscle analysis. The joint might not be moving much, so I would say that was relatively isometric. Even though you saw a lot of pelvic moving, he could be doing like a reverse sit-up and really get that trunk flexion, but these muscles are coming in to stabilize to allow that to happen, and the hip is moving the most, and you're going to have those hip flexors that are moving there. The point of me including this exercise was more to show the reverse action, that it's going to be similar movements in terms of the pelvis moving relative to the torso, or the torso moving relative to the pelvis. And again, you see the skeletal view, rec fem, psoas. Let me see if I have this queued up already. So next video here, So medicine ball toss, anti-gravity position, but a little bit of acceleration. So there's a concentric phase and eccentric phase that's happening. So your goal is to figure out which one is concentric, which one's eccentric, and then analyze which joint actions. So it's going to be trunk rotation. Is it left or right rotation? That is the concentric or eccentric phase. And then analyze the exercises for that. So right now, she's trying to slow that ball down. So the ball has some velocity that this guy threw at it, and they're not really equally positioned there, right? This guy's going to, I don't know, whatever. But this ball he's throwing this ball. Hopefully he's not throwing it too hard. She has to slow it down, and then has to change directions and go this direction. So gravity is down the entire time. So gravity really isn't the resistance anymore in this equation. So this would be like tubing or pulleys, where the resistance now is the momentum that this guy imparted on this ball. So he throws this ball, he throws it at a certain velocity. She catches it and slows it down. So this is this phase from here to here is the braking phase, the deceleration phase, which is eccentric. And then she's going to switch directions. So the ball's coming this way, she's going to cycle back and throw it back at him. This becomes the concentric phase. So when she's throwing the ball concentrically, she's doing left trunk rotation and eccentrically right trunk rotation. Conversely, when she throws the ball to him, she's throwing it, he's catching it, decelerating, right? Eccentric, and then the ball's still trying to move in that direction. He's slowed it down, and now he's trying to circle back and throw it that way. So for him, left trunk rotation is the eccentric phase, and right trunk rotation is the concentric phase. Same muscles, guys. Same muscles. He's working his right internal oblique, left external oblique the entire time. She's working, so she's doing left trunk. She's working left internal oblique, right external oblique the entire time. In order for them to change, they got to turn around or switch sides. So the throw is the concentric phase, the catch is the eccentric phase, and depending upon who you're looking at, person on the left, person on the right, and then you guys got the agonist, the muscles for there. So same side internal oblique always for the same direction that you're rotating, opposite side external, same side erector, opposite side transverse spinalis group. And that's it. So sorry for the video, first video I've done in a long time. But hopefully it's helpful, and you'll have time to play it back. I'll do a couple other, that's probably how we're going to be moving for the rest of the semester, but hopefully that cleared up quite a bit of things, and please make sure you are doing the review questions in the book, and going from there. So please feel free to shoot me an email if you have any questions.